my name's Kim Scott. I'm a marriage family therapist with Practical CE Seminars, and in March I'm going to be conducting a live seminar on critical incident stress management. The Mitchell model was originally created for work with police, firefighters, paramedics, the first responders. But over the years it has come to be the standard used in businesses as well. So oftentimes when an EAP is looking for a therapist who can come out to do a robbery desensitization or a grief group or some other kind of crisis group in a corporate environment, they want someone who's Mitchell trained. Our CISM Fusion course will give you that. And we also talk about the differences and what to look for in a corporate environment and how to tweak the skills so that they'll actually fit that setting. A couple little tips right off the top is in a corporate environment, you may not have as much time and as much lead up as you would if you were working with police or firefighter or paramedics. You might have 1 hour to work with everyone who's been involved in the incident, and that hour might come right before their shift. So it's still good to follow the Mitchell model. You do an introduction, begin with a fact-finding phase, try to let anyone who wants to talk, begin with discussing thoughts, and then move a teeny bit into feelings. But since you only have about an hour, it's really most important that in the time that you spend together, you give the participants some skills that they can use to deal with the stress that they've experienced. It's also really important that you help normalize what they're going through. Oftentimes, when a person's feelings are overcome with all the emotion following a crisis, it can make them feel a little crazy and a little off balance. So the therapist's job in the debriefing in the short amount of time they have is to normalize, to let the person know that they might be reliving the experience. They might hear the sounds, smell some of the smells. They might be afraid, and they might dream about it. Normalizing the situation and giving the individuals coping skills so that when they leave that session and go back on to their shift, that they have some things under their belt to how they can cope with the situation. It's also important to let the individuals know where to go for help. If you've been sent in by an EAP, generally you'll be giving the Employee Assistance Program's phone number, and the employees can call there to get help to deal with their feelings. Usually their spouses and family members can also, because when there's a crisis at work, it can shake up the whole family, even those people who aren't in the situation. So giving the information is equally as important as giving the employees a chance to talk, because a lot of people aren't going to feel comfortable opening up at that moment, but at least if they have a little bit of information to go on, they'll know where they can go for some additional help, and they'll have some skills to begin the process. It's also important that as you're hearing people talk, as you're seeing them sit there, you're looking for any signs of someone who may be experiencing more significant troubles. And then after the debriefing, talking to that person privately and suggesting they call the EAP would be a great way to reach out and intervene on someone who might be struggling a little bit more than others. If you'd like to register for our class, there is still space. There's going to be a session in Oakland, San Diego, Orange, and Northridge. Just go to our website at www.practicalceseminars.com and follow the registration buttons for CISM Fusion. We look forward to working with you.